There's not one type of intelligence. There's infinite types of intelligence. Therefore, there's infinite types of culture.
My name is Ansa Achea, and I'm an American citizen of Ghanaian descent. I'm also an actor, an artist, director, and educator. I'm taking a trip across the state to meet our neighbors, learn what brings us together as Minnesotans, and celebrate the ways in which our distinct cultures lay the foundation for healthy living. In this video, I'm meeting with members of the Latine community. The gender-inclusive term Latine is used in lieu of the gender-specific Latino and Latina to represent all individuals in the community. Many ethnic and national backgrounds form the Latine community, including people from Mexico, Puerto Rico, Ecuador, El Salvador, and dozens of other countries and territories. Their reasons for immigrating to the United States are as diverse as their cultures.
The libraries have a special space in my heart. When I came from Puerto Rico, I couldn't speak English, so the library was my place to go to try to read books, English classes. They make me feel welcome here. Puerto Rico is an island in the Caribbean. It's a U.S. territory, it's a Commonwealth. We believe that Puerto Rico is a country, even though we're part of the U.S. We have our own identity, our cultura. When I moved to Weber Lake, my family was the first family of color to move to that part of the neighborhood. And so it was different. I am sure very impactful for the neighbors, especially to hear my drums and to see my daughters dancing outdoors. We wanted to bring Puerto Rico to the neighborhood, and my husband is from Nigeria, so we wanted to bring all of that and share with the entire neighborhood. And it took some years for them to know us and relax around us, and for us to relax around them.
We're here at the Science Museum, this awesome mural that you created, along with some awesome young people, from what I understand. And I'm really curious to find out, what your journey has been.
I'm from Chile, South America. Honestly, I've always loved making stuff. Since I was a little boy and I learned how to grab the pencil, I just started doing lines and never stopped. I have to show the people that I care for how it could be. And I want the world to be like this. In particular for this mural, I came in to a classroom full of youth, and I told them I need you guys' input and ideas so we can come up with something that inspires us all. And as you can see, my message is we heal through nature. That is the healer we have here and provides for us everything we need to take care of our own bodies.
The Latine community brings so much beauty to our region, yet also faces widespread health disparities and chronic disease and illness due to external factors such as insufficient access to coverage and care that is timely, affordable, and culturally concordant. One common example is that language and cultural barriers in the clinic can stand in the way of Latine patients receiving the care they need.
We really look at these words of equity, what is it, and the diversity and the inclusion that we must all strike for as, concepts that are great. But if you don't take the concept and make it your own practice, then it's just a word, it's just a concept, it's just a beautiful idea.
Patients that don't speak English as their first language, they do not know how to express what they're feeling, their pain. Parents have to take their small children so that they can translate. And then children don't know the vocabulary necessary.
My background is Norwegian and Bolivian, and my parents spoke Spanish in the home growing up. This clinic, where a majority of our patients speak Spanish as their native language, just felt like home when I interviewed here, and it was a great place to be. You feel the impact of walking in with families and immediately speaking their native tongue, how there's just a relaxation immediately. They can just calm down, they can just speak in the language they want, and somebody will understand them, somebody will hear them.
The COVID vaccine shot, where I was hesitating. I was in a place where I didn't want to explain to this lady, there's been many times where we've been used as experimental rats for new medicines. And even though in my lifetime I haven't suffered from that, I carry that in my DNA. Just like I look like my great-great-grandfather, I may have his traumas too. It's this exact same.
Practitioners in healthcare do a lot of work in a transactional way because the system that we're part of, many times it is designed to be transactional. You have 20 minutes to see your physician, and those 20 minutes, they try to do their very best. The first 2 minutes, I always think about the first 2 minutes. Those first 2 minutes are critical for us to start building relationships. To stop after you wash your hands, to sit down and make real contact with me and tell me that you're present. I know that it's a lot that's going on for practitioners, but please take that time. If you take that time, I will trust you. I will listen to you. I will believe what you have to say to me.
You're also connected to a school. I don't think I've ever been in a situation where I would be able to drop off my kid and literally take a left and then come to a clinic. Does that change the dynamic of the folks that come through the door?
For a family that has to work all day, if their kid can just get checked out, caught up on vaccines in the clinic nearby, it's quite impactful and helpful. Nobody is alone. Like, they're surrounded by a system. They're surrounded by a support network. At our site, we have what's called a patient advocate that helps navigate insurance and connect our families with services. I regularly help write letters for families stating what they need to keep their families healthy. And so sometimes that means repainting a building with lead paint because that can be harmful for cognitive development. I've seen the impact that an integrative approach and truly family-centered care can have.
Talk to me, collaborate with me, partner with me, because if you do that, then together we can create that space.
People are realizing that each culture has a lot more in common than they have in difference,
I love talking about my culture, and I come from a we culture, W-E culture, where I cannot think about myself as an individual without thinking about my family. Every time I play my drum, it's like a calling to be alive, to stay alive, to fight, to be the best of who we are. It is a great way to heal. And somehow for a moment, for a minute or 2 minutes, we are part of the same thing,
We have so much to learn from the cultures of our neighbors. I hope you join me as we listen deeply to their stories and strengthen our communities together.